So laparoscopic appendicectomy is one of the first procedures that you will encounter, and also the instrumentation shown in this particular video is very basic. So we are just using a simple bipolar and cold scissors. The port position is as follows: 10 millimeter suprapubic port, 5 millimeter supraumbilical port, and also we have inserted the camera of 5 millimeter in the supraumbilical area and 5 millimeter of left iliac fossa port. So 3-port technique. We locate the appendix, and what we do is we hold the appendix with the left hand, give traction, make the meso-appendix taut, okay, and then you do the bipolar, you coagulate, and you coagulate the cut and you cut the coagulated area. So you see the trick of coagulation here is, what I am doing is I coagulate once in the middle, once above it, and once below it, again in the middle, and then I cut. So you do not just straightforward just coagulate, take out your instrument and cut. Always use what is known as a sandwich or a pressing technique. Okay, so up, down, middle, again middle, and then cut. See, up, down, then again I am going to be cauterizing gently up, and now I will cut this coagulated area. So this will prevent any chances of bleeding in this particular area. Now what I usually do is, once I reach near the appendix, I start going down. Okay. Now you also can notice the curve of my bipolar. I have turned it now, and it is just in line or parallel to the lumen of the appendix. By similar movements, what we do is we come to the base. Now once you have taken the base, just realize that you do not pull too much of the appendix, because the terminal part of the cecum will also get taut up and it will appear to be like the base of the appendix. So when you are near the base of the appendix, just relax the left hand traction and see. Now I have inserted a loop at the base of the appendix. See, left hand is pretty much relaxed, and how much traction you have to give is, you can see the blanching. Okay, you can see the blanching on this tissue, blanching on the appendix. Once you attain this blanching, you do not give further pull on your loop. Once you have looped, what you do is you take out the loop and put the scissor back in the same tract and cut it. This is again the second loop, that is the Roder's knot, indigenous Roder's knot with the vicryl that has been placed. Then the second loop is being put. Usually initially in my practice, what I used to do was, I used to take 2 loops on the patient side and 1 loop on the specimen side. But gradually I have started taking 1 loop itself on the patient side and then cutting. If the appendix is very turgid and you see a fecalith or pus is there, then I usually take 1 more loop and ligate it on the patient side as well, so that there is minimum chance of the spillage. So you see, I am giving too much of traction, and the cecum also appears to be like the base of the appendix. So that should not happen. Now what we have done is, we have taken the 2 loops, we have ligated them, and now we are going to cut. While cutting, just make sure that you do not cut the knot that you have placed. Once you have cut the knot, the proper another sign that your knot is taut is that it is not bleeding, and you can take out the appendix via the port. Thank you.